عدة أمراض بتحصل وتمرض البقرة وبتموت وما حدا بيعرف شو مشكلتها.
The farmer survives the elements, water shortage, and endures overbuilding that encroaches over his livestock's grazing, and yet we all continue to depend on him for our subsistence. In conflict areas like Syria, farmers have an added concern where the livestock trade is at great risk. Lebanese and Syrian border farmers face security risks, scarcity in grazing pastures, and a reduction of feed and vaccine subsidies that were provided in pre-war Syria. The result has been an increase in transboundary animal diseases that have proven fatal to the livestock of Lebanese farmers and of Syrian refugees in Lebanon, and have caused extreme poverty for many of them. Funded by the UK aid, the FAO launched a project in 2013 to help Lebanon's Ministry of Agriculture fight and contain animal diseases. The project also builds national animal diseases control capacities and supports disadvantaged farmers.
Ce projet d'une durée de 2 ans s'inscrit dans le cadre d'un vaste programme d'urgence de la FAO, élaboré après une évaluation sous-régionale, à l'effet de réduire l'impact de la crise syrienne sur les politiques de sécurité alimentaire telles qu'elles sont menées au Liban. Il s'appuie sur une grande opération de vaccination du cheptel présent sur le territoire libanais.
من الأسباب الأساسية لوجود البرنامج الإمرجنسي فاكسينيشن هو أكيد الأزمة الحاصلة بسوريا يلي أدى لتدفق عدد كبير من اللاجئين السوريين واللي اصطحبوا معهم الحيوانات اللي كانوا يربوها لداخل الأراضي اللبنانية.
يأتي هذا المشروع في فترة المزارعين اللبنانيين خاصة صغار مربي الأبقار والأغنام في لبنان في أمس الحاجة إله نتيجة للمشاكل التي نشأت عن الأزمة السورية الحالية.
The inflow of refugees from Syria has placed an added pressure on available food and other supplies in Lebanon, where registered refugees number over 1.15 million. Today, Lebanon is facing a situation of extreme instability, and the cumulative challenges affecting Lebanon's economy could push large areas of the country into further poverty. The war in Syria has greatly impacted the well-being and livelihood of Lebanese farmers and livestock producers, especially along the borders with Syria. Having already lost access to subsidized farm inputs originating from Syria, these communities are also suffering from increased risks of transboundary animal diseases. The most commonly encountered transboundary animal diseases are foot and mouth disease, peste des petits ruminants, and lumpy skin disease. Foot and mouth disease is a highly contagious viral disease of cattle and small ruminants causing ulceration of the hooves and the mouth. Peste des petits ruminants is a contagious viral disease that can cause high mortality rate in sheep and goats. Lumpy skin disease is a viral disease that affects cattle, which has spread to the entire border region since 2013. These diseases cause animals to produce less and bad quality milk and meat products and are often fatal to the animals. Peste des petits ruminants and lumpy skin disease do not pose health risks to humans. However, food products from infected animals are unsafe for consumption.
الوزارة تشتري سنويا اللقاحات اللازمة لتغطي الأراضي اللبنانية كلها، بس كان يكون عندنا مشاكل كتير بالتغطية من ناحية الكادر البشري.
Lebanon is not a flat country. It is a rock going into the sea. And that means that to reach the farmer, they are all scattered in the small mountain. And it takes a lot of difficulties and time to go and to immunize 2 animals here, 3 animals there.
ما كنا عندنا الكادر الكافي يقدروا يدخلوا على جميع الأراضي اللبنانية لحتى يعملوا البريفونسيون أو يطعموا الحيوانات الموجودة بهالمناطق هيدي.
وحدودنا مفتوحة قدام الرعي وخاصة عرب الرحل اللي بيرعوا أغنامهم، وهي الأمراض أكيد حتنتقل وتفوت لعنا. وأكيد
هيدي عملتنا مشكلة نوعا ما، لأنه وزارة الزراعة عندها برنامج تحصيني للحيوانات الموجودة على الأراضي اللبنانية حسب المعطيات اللي عندنا.
قبل كانت تحصل عندنا مشاكل كثيرة وتموت البقرة وما حدا يعرف شو مشكلتها.
تخسرت أنا، مات عندي 3 بقرات.
أنا في عندي 6 روس راح منهم 3 وبقت 3.
Why it has to be done in the short term is because when you immunize, you want them to be all protected at the same time. You don't want to have part of your country that is still at risk when the other part is not. Immunizing a national herd in the short term demands a lot of organization, but also a lot of cooperation.
FAO has already begun implementing urgently needed interventions to support the Lebanese Ministry of Agriculture in ramping up disease surveillance, quarantine measures, vaccination and animal diseases control programs. The project for emergency vaccination and targeted feeding of livestock in areas along the Syria-Lebanon border is enhancing food security conditions for the population affected by the ongoing crisis by reducing the threat of the animal diseases and the number of animals dying, malnourished and being sold at reduced prices. This support helps farmers to keep their livestock assets, their only source of income during these difficult times, and their access to nutritious animal protein. In order to improve veterinary services and to increase the number of vaccinated animals, FAO is training veterinary professionals as well as community animal resources development workers on disease surveillance, identification and early reporting of animal diseases outbreaks. Another crucial element of the training is to empower farmers to direct their own learning through the farmer livestock field schools. This grassroots approach uses interactive tools to help farmers to retain their livestock and make a living out of them.
من ضمن هالمشروع هيدا حيتم مسح وبائي، يعني حيتم سحب عينات من جميع القطعان الموجودة على الأراضي اللبنانية ليتم فحصها لحتى نرسم خطة واضحة لفعالية هالتحصينات اللي عم نعملها وللوضع الوبائي الموجود عندنا على الأراضي اللبنانية.
To be able to do that, we had over 40 teams of vaccination team, including veterinarians and technical staff.
This project succeeded in achieving a real blanket vaccination coverage for both cattle and small ruminant. 99% of cattle were vaccinated against foot and mouth disease and lumpy skin disease. As for small ruminants, the coverage percentage was 96%. As for the feed distribution, quality animal feed was distributed in 12 different locations that covered all areas where the majority of the livestock owners are located. A total of 5,229 vulnerable farmers benefited from feed distribution. In addition, this project contributed immensely in building the capacity of animal health providers at the Ministry of Agriculture. A total of 114 animal health providers were trained on subjects such as epidemiology, field and laboratory diagnosis of animal infectious diseases, disease statistics, animal welfare, biosafety and biosecurity. The FAO vaccination approach also sees the development of a national strategy for controlling animal diseases based on reports by communities and national veterinary authorities, detailing previous history and vaccination and post-vaccination monitoring.
Because we had such a great number of teams, we managed to do it in less than 3 months to do the full coverage of the national health.
وبقي عندنا عدد قليل لنكمل المشروع لحتى نكون بهالشغله. قدرنا غطينا كل لبنان من حيث التطعيم والتلقيح ضد هول الامراض.
Mes remerciements pour le gouvernement britannique ainsi qu'au personnel du ministère de l'Agriculture pour l'engouement qu'ils ont manifesté lors de la mise en œuvre de ce projet.
نشكر منظمة الفاو على المساعدات اللي قدمتها، وإن شاء الله أنه خفت الأمراض بالمواشي من يوم بلشت تساعد، ونتمنى منها كمان أن تظل مستمرة بالمساعدة للشعب الفقير والشعب المسكين.
وكل فترة بفترة يطلوا يزورونا بالمزارع ويشوفوا شو معاناتنا.
قدمت لنا منظمة الفاو بالتنسيق مع وزارة الزراعة كل الطعومات اللازمة، وساعدونا كتير وأنقذونا من هالمحنة اللي كنا مارقين فيها.
لو ما تطعموا كان راحوا كله.
صاروا يجوا يطعموا للبقر ويشوفوا يعني الحالة اللي عندنا بالمزرعة، صاروا يجوا ياخذوا عينات عنا وياخذوها يفحصوها.
قدموا لنا الطعومة وكل اللوازم الطبية،
فصار الحمد لله يشجعونا ان نشتري بقر.
The achievements reached by this project have improved delivery of veterinary services and helped farmers to retain their livestock. In total, 10,235 households have benefited from this project by improving their income and their families' nutritional conditions.
إن شاء الله نكون وصلنا أكبر قدر من المعرفة ومن الخدمة البيطرية.
Nothing is impossible, and with the collaboration work that we had with the ministry, we believe we can repeat this activity next year.